Right, broadcasting. And I think we're live. Okay, so welcome everybody to WorkReduce Live. This is our panel on going back to school. We're gonna wait a couple minutes for participants to start rolling in here. This is maybe the fifth of our live panel series where we've been discussing topics germane to the ad industry. This one we're broadening our horizons a little bit and talking about something that affects everybody, with an eye towards those of us who are in the business. And in a minute, I'll be turning this over to Rachel Barek, who will be moderating today's panel, and then she'll go through the intros for the team, and we'll go from there. By way of introduction, WorkReduce is a company that provides staff augmentation and service desks to the advertising industry. And this is our panel series where we've been bringing a lot of different topics together. We've covered ad fraud, planning tools, and now something that Rachel, who's part of my executive team, and other folks have been on our team have been really, really passionate about, which is how are we thinking about and handling going back to school, both from a perspective of managers, as parents, and I'm not, which is why I'm going to step back and turn it over to this panel of parents, and just as people assessing risk in a really uncertain time. So again, we're really glad to have everybody here, and I think I'd also say that we're coming at this from a position of people in white collar jobs, right, where we do have a lot of options that not everybody has. So it's definitely a position of privilege that we're addressing this problem from, but I think it's still very important and germane for all of us. I've had a number of our contacts in the industry, COOs and CEOs of massive corporations saying, Brian, what is going on? Do you have any secrets from running a virtual company for 6 years? And the answer is, I don't. Maybe everybody on this call does, and we're going to hear about it, but everyone is kind of making up the playbook, I think, as they go along. And while we certainly have lots of tips about what it's like to work remotely in general, we're still working remotely under duress in a crisis, and who the hell knows what is happening with millions of kids across the country going back to school, and some early indications from a couple universities that it could be an interesting time. With that, I'm going to turn it over to Rachel Barek, who's a WorkReduce advisor and consultant, and who's going to be leading the panel today.
Hello, everybody. First, I'm going to caveat this panel with the fact that I am a mom to a 5-year-old and a 3-year-old. And the 5-year-old got a little bit excited in round one. I think we're going to call the game from there, but I hoped that the eye injury matched.
We can't see the black eye. You're a little shaded, so no one knows you have a black eye except you just told everybody.
Yeah, and just to glom on to the notion of privilege, it's really real. I'm happily married. I have some financial resources. I have the ability to work from home, as does my spouse, and this has been impossible and really unprecedented for us. The amount of side hustle we've had to do to figure out alternative childcare for our kids, or even at times in the beginning when we didn't identify somebody to watch them. We split up our day where we were waking up at 4:30 in the morning to be able to get our regular workload done, as well as take care of our kids. So as much as we have tips and tools and situational flexibility, we're here to really address that, grab onto it, and talk to you guys today. So with that, I was just hoping the panelists could introduce themselves, tell me a little bit about the scope of your job, and because it's germane to this conversation, tell me if you have kids, and if so, what ages they are, and if you are lucky enough to co-parent with anybody. Zach, will you lead us off?
Sure, thanks, Rachel. I'm Zack Bernstein. I'm work for the Office of the Director of National Intelligence, so it's a government job, overseeing analysis on a variety of arms control and weapons-related topics. I have a 4-year-old with my husband. So we are also in the privilege of having a 2-parent household. And it has been tough trying to make this all work. We live in Washington, D.C. With a pretty great support network, except in the age of COVID, you can't really use your support network. So it's been definitely a challenge.
And Zach, given the scope of your job, I'm guessing when you're at work, there are many times where you're not able to do it from home and are potentially unreachable.
Yeah, so for me, I can't work from home at all. We've been able to have some flexibility with some people to do some work from home, but my work, I literally can't even check email from home, which means when I'm in the office, I am completely disconnected and I'm in the office. It means my husband bears the full burden of childcare when we don't have other options. So once school's closed, we basically had to juggle that. I've been very fortunate that we basically went into a alternating week schedule towards the beginning of this to try to help keep our workforce safe, which also meant that every other week I could be doing a lot of the childcare. So it was sort of a feast and famine setup where one week I had a lot of flexibility to be basically a stay-at-home dad. And then the other week, my husband had to both work from home while also trying to manage a 4-year-old, which if he were on this panel, he would tell you was very, very challenging.
Thank you. And Courtney, will you go next?
Most definitely. Hi, I'm Courtney Lagace, and I am the manager of global employee well-being for Colgate-Palmolive. And so my responsibility is the health and well-being of our employees around the globe. We operate in about 100 countries, and we have half of our workforce that is currently working through the pandemic in our plant setting. And then we also have half of our workforce around the globe that are fortunate enough to be able to be working remotely. And so we definitely have both sides of the coin, if you will, that Zack was just talking about. So I do not have any children of my own, but I'm a very active aunt of 2 of my nieces, age 2 and age 7. And I'm very fortunate to be able to live close by and have definitely been tapped on the shoulder to kind of support their household as they're managing through what we're talking about today.
Excellent. Thank you so much, Courtney. And Ben, can you please introduce yourself?
I'm Ben Sommers. I'm a professor of health policy and economics at the Harvard School of Public Health, and I'm also a primary care doctor at a community health center in Boston. I have a 9-year-old and a 5-year-old. My wife is also a physician and a researcher, and we don't have any outside childcare, so we spent basically the whole spring trying to figure out how to tag team our childcare, and just the 2 of us, and splitting up our homeschooling responsibilities for the kids and seeing patients. I telework on my days that I'm doing the kind of policy, and then on days that I'm seeing patients, I'm obviously physically there. And my wife works kind of an feast or famine as well. She works 2-week blocks in the hospital, and so when she's on for 2 weeks, that means I was full-time duty with the kids and also trying to do my job when feasible.
Got it. And from what I'm hearing, the New York Times just came out yesterday with a stat that says coming into this year, most schools are going to be remote only, and about 4 out of every 5 parents, so 80%, depending on how you run the numbers, are going to be attempting to work full-time jobs remotely from home, as well as providing childcare. Ben, I look to you first, both from like a public health and a public policy perspective. Knowing this, what's the best that we as individuals can do, and sort of what's the best that employers can do to help out these individuals who are probably physically and emotionally just stretched to beyond their wildest dreams, and knowing that this might be a marathon that would be upwards of a year from now?
Yeah. Well, so from the public health side, there are obviously huge issues in terms of the stakes of whether and when we reopen, and what the impacts to kids of being out of school for months and months at a time is, and we can talk about that. I know that's not the focus here, but in terms of what can employers do, I think one aspect that really is important to recognize is that there's growing evidence that this prolonged period without being in school in person has had pretty substantial effects on kids in terms of mental health, and in terms of educational gaps, as well as food insecurity, rates of child neglect. So, under the best of circumstances, what you have is parents trying to help their kids through essentially an unprecedented chapter of childhood that fortunately none of us ever experienced, right? And so it's not just that there's childcare that needs to be done, it's that it's actually more intensive. Our children's need for us is significantly greater than it is under the best of circumstances, right? It's not just that it's not like 2 weeks of vacation, they're just around. They really need parental engagement and support, especially younger kids who are trying and expected to be doing some sort of remote learning. 5-year-olds, 7-year-olds, they can't do remote learning without heavy parent involvement. And so I think it is very easy because the world has changed so much, but people are very good at adapting to new circumstances. I think especially for people who do not have young children at home, you need to remind yourself every day you talk to one of your employees who does, that this is essentially unprecedented in the history of their career. And that there's, just because we're 6 months in, it doesn't get easier. It gets harder as the cumulative toll on the kids becomes clearer. So, that's, I think, first and foremost, is just to don't forget that. We've all gotten used to Zoom. Our kids have not gotten used to being out of school. That's not the normal childhood.
Thank you so much for that. And it really, that hits home. I spend a lot of time talking with Brian about WorkReduce and our respective employees and what can we do to make this better, recognizing that these are truly unprecedented times. And we come up with ideas like people can work alternative schedules, or maybe we can reduce their job down just to the core essential functions and have expectations that those guys are just going to do the basics and get it done. And the superfluous stuff we can extract and pull out, knowing that everybody essentially has to do double duty and they're physically not enough hours in the day. And when I put on my employer hat, I feel fantastic about what we're doing. But when I put on my parent hat, even those releases, right? We loosen the belt as much as we can. It's still not enough. And I think both the parents and the kids are feeling this. And I'm curious if this is something that's happening because of, what's happening policy-wise within the United States. And Courtney, I just want to look to you because you're part of an HR and wellness team for a global company. I'm curious how you're seeing this play out both across the United States as well as internationally, and then if certain workers are feeling this more than others.
No, thank you, definitely. And what we're seeing is, I think a lot of companies, and this actually came out, Salesforce came out yesterday to say they're not going to bring back their workforce until August next year, with honestly the thought behind that they want to give parents the ability to plan long term. And so I think, Rachel, you're talking about the short term goals that we're seeing people do, where it's trying to loosen workload, try to balance flexible work hours, but there needs to be this long-term planning that a family can make. And so we're starting to see that we're past the temporary point, and employers are really understanding that we're at our inflection point. What are we going to do long-term? This is our new reality. And it's the new reality, as you mentioned, for 1 in 5 of our employees around the globe. And what we see is that is a piece that we're all looking at. And one of the pieces that we're trying to understand are, what are those policies that we're looking at that we've kind of piecemealed together, and figuring out what can be a longer term play there. And so I think one of the pieces that was interesting out of a study that was done by Mercer is that about 56% of those that are caregivers, and so we're also thinking children in this panel, but we're also looking at those that may be taking care of parents at home, that they have not raised the fact that they're a caregiver and potentially trying to balance that with their direct supervisor, over half. And so if we were to look at trying to create policies, I think we're potentially creating them a little bit in a bubble, but trying to understand and create that connection of what do employees need. And that's an area that we're trying to understand from our employee base. What is our long-term play? So that's the area that we're looking at right now. When we talk about policies, how do you match what we've had from a government perspective that's allowed by law, and what can we do to make sure that we're supporting them? So it does vary by country, by the policies that are allowed on leave and flexibility. But I do also think there's a manager and employee relationship that we really need to look at and talk about, that empathy of understanding people are in a very different and tough situation. So.
No, thank you for that. Ben, sort of same question to you. I'm just curious, how are hospitals managing this, knowing that many frontline workers are also parents and caregivers themselves? Is there any sort of relief for them? Or are there any policies that are being created that we can know about and maybe leverage?
So the use of emergency, or I guess it's not emergency anymore, it's kind of a long-term approach of adding capacity for childcare for frontline workers has been a priority for a lot of hospital systems. Right? When the kind of community-based early childhood centers and schools closed, there had to be something to step in, or the workforce to take care of patients just would have been decimated. So that, especially larger practices, big academic medical centers, big hospital systems have the resources to set up, in some cases, their own, new childcare, or at least to prioritize the existing childcare capacity they have to make sure that they can staff what needs to be staffed. Hospitals and doctors' offices, a lot of our staff don't have to be on site. And so there's been a lot of thought carefully into who needs to be physically present and who doesn't. So for instance, in my clinic, a lot of the referral coordinators, a lot of the billing is now being done remotely. More of the mental health services are being done remotely, whereas the in-person physical visits that need to be done with a doctor or a nurse in the room, we're kind of trying to prioritize that by clearing out more space in the building. And also from the childcare perspective, that if you're able to prioritize the on-site childcare services for those who have no other choice but to come to work, that can help. But it's not it's a difficult balance, and there's also no great replacement when you're talking about elementary school, where these are not really, you can't set up an emergency childcare center practically for 10-year-olds. But on the other hand, parents can't leave 10-year-olds home all day, and even if they could, they kind of need to be engaged and supported for the school aspect of what they're doing at home. I guess one thing I'll say, I like Courtney's comment was really interesting to think about the long term. And one of the wrinkles here, though, and I'll say this as somebody who's working on some of the school reopening policies in our community, is that unless you basically say we're doing a full remote for the year, which some places are doing, but unless you kind of write off the whole year as no way we can do anything in person for anyone, if you're trying to maintain the possibility of getting some of the younger kids back in, or at least doing some hybrid model, you're going to have uncertainty, because in communities that are opening, where rates are low and safeguards are in place, that's a one-time decision now, but 2 months from now, we don't know where we're going to be. And so maybe the communities that reasonably are deciding that they're going to open for some in-person education now, come flu season, that may be less sustainable, as more and more people are having symptoms that are either COVID or not, but it's just you have more people quarantining. You also have less time outdoors. You can't use outdoor space. You can't ventilate the rooms with windows as much. So it isn't necessarily obvious that for school purposes that you can plan out this whole year, unless you decide no matter what happens, we're not going to let kids back in the building. And while there are some districts that are deciding that, I think many districts are trying to be a little more open to different scenarios, because that is just a tremendous loss to the children to sign off a whole year of in-person learning. So there's only so much employers can do when the parents and the kids themselves don't quite know what the schedule is going to look like. But I think the notion of taking a long view, so that there, at least from the employer side, that there's not a lot of uncertainty into what is already a really uncertain circumstance is really important.
I'm hearing, Ben, this question is still to you. I think it's germane to this topic, and probably why, if I had to guess, a lot of people are tuning in, which is, how do parents know when to make the right decision if they have the option for in-person learning, on how to set it up? And so many folks I know who have the means and have the privilege are getting creative. They're creating pods and hiring teachers privately. They are, I heard about this in New York City, a group of parents pooled together who have kids ranging from 7 years old to 13 years old. And they hired a tutor and rented out a bar and grill with enough table space to set the kids up in different areas so that they had the distance, but there was somebody there watching them, so that those kids didn't have to be home in small, tiny New York apartments, so that the parents could focus on their work and get it done. And even just the cost of that and the burden of that, while creative, is really, it's privileged and accessible to them, and maybe not to everybody else. So as a parent, regardless of the means that you have, like, what is your advice to parents on how to make these decisions in terms of when to send their kid back if they have flexibility?
Yeah. Well, so I think most schools, at least, I'm mostly familiar with what's going on in Massachusetts and a couple of the other big cities that
Sure.
profiled nationally. Almost everywhere most of the places that around here that are opening for some in-person learning are maintaining a remote option for those, for parents or for children who choose that. And there are good reasons for that. If you have, high-risk family members, either the child or caretaker who would be, at significant risk, or just, parental kind of preference that they just are, their risk tolerance for the child being in school is such that they just want them to stay home. So, yeah, so there are a lot of parents who are having to kind of make this choice. in the smaller parts of, the parts of the country that are having some reopening. And that's a very individualized decision. I think I would recommend that anyone who is making that decision based on their own health status or their children's should talk to their own healthcare provider. Talk to your pediatrician or talk to your own primary care provider if you're feeling like this is high risk. I think one of the misperceptions that in public health in general, but and also just any major policy decision is sometimes the risks are scarier than the risks you don't. And what I mean by that may sound backwards, but what I actually mean by that is the idea of going to school sounds scary because you're like, wow, well, there's just gonna be all these kids around and there's gonna, who knows what's gonna happen, and the people will be passing this around. Well, the question is, what happens if your kid isn't in school? And if what that means in practice is that kid's going to be with a circling cast of whoever's at the playground the day that they're at the playground, and that you're going to be having to use a rotating cast of babysitters or other childcare. Is that better or worse? Well, depends. I mean, a lot of the schools are implementing a variety of safeguards in terms of universal masking, physical distancing, ventilation upgrades. And some of the other options people might be pursuing don't have those features. So it's not immediately clear that putting your kid with eight other of your friends' kids, in some rented space with a kind of hired supervisor is lower risk than them being in a school that's taking appropriate safeguards. It may be, but it may not be. And so I think that's a really important set of questions. And none of us are going to become experts on building safety overnight to try to figure out what space is best for our kids. And that is scary, just the kind of that uncertainty. Outdoor spaces are better than indoor. More space is better than less. Consistent use of masks and hand hygiene is really important. But there's no kind of simple answer to can I send my kids back, and asking the questions you can to kind of see the guidance of how is your town making these decisions? What does it look like they're being thoughtful about it, or are they just kind of knee-jerk, running into something without precautions in place? Because it's very clear from the evidence is that if you open any environment, whether it's a school, whether it's a camp, whether it's restaurants, or large gatherings or wedding receptions, if you don't take precautions, COVID can spread rapidly. On the other hand, there's a fair bit of evidence now internationally that if you open schools in areas where community spread is under control and you use these safeguards, that the risk of school-based transmission is low. It's not zero, but it's low. And so many parents might feel comfortable if they do see that those guidelines are in place. And so it's not going to be for everybody, but the non-school options, you have to interrogate those just as carefully as the in-school options before deciding that it's actually better off or safer.
Yeah, thank you so much for that, Ben. That was really helpful. This is a little bit of a jump ball, but I think I'm looking a little bit more towards Courtney and Zack, just as managers of teams, and Zack managing a team that I'm guessing works in an incredibly secure environment. And if there was an emergency at home, they need to get a phone call and get pulled out of that environment to be able to go deal with something. So truly removed. Is that a fair assumption of the nature in which you work?
Yes.
Okay. And Courtney, just knowing that you're managing a global workforce, are you guys getting employees coming to you going, I don't know how to keep doing my job. I'm struggling. I'm having issues. Or do you feel like people, for the most part, are kind of burying their head in the sand and just trying to slog through this? Because I'm generally worried about the workforce. And if I'm honest, I think women in general, as primary caregivers, they're shouldering the burden of both of this. So I'm just curious what you guys are seeing out there in real life and in real time.
Yeah, I mean, so speaking for us, we gave people the option very early to essentially pull themselves out of the office environment if they were at high risk. In most businesses, that means you can have people just working from home. In ours, we do our best to have some remote options for doing some work in support, but a lot of the vast majority of the critical work we do cannot be done outside of the office. So what that means is essentially some percentage of our workforce has kind of been out doing the critical functions for the duration. There's just no real way around that when it's that or someone's physical safety. What that does is shift the burden to the people that have deemed themselves still able to come into the office. We've put the staff into 2 teams on alternating weeks to help reduce safety. Everyone's in a mask in the building except when they're in their own individual office. you know, there are hand sanitizer stations now every 10 feet throughout the entire building, et cetera, et cetera. And we do a pretty elaborate system of contact tracing anytime you are in close proximity to other people, not doing things just remotely. So we've done all of that, but by the nature of the work, you know, there aren't a lot of, there's only so much flexibility we can give to workers. What we have done is give people maximum flexibility in terms of work hours, both total number of hours they're spending in the office, but also what schedule they're working to fit around their family obligations. My team specifically, it's only me and one other person on our team that has school-age kids, which has its advantages because it means there are only two of us that have to really work around a childcare schedule. But I'm very conscious of avoiding shifting too much of a burden on to the people that don't have kids, right? There's the reality of, you know, if you have kids, you have to take care of them and you have to do school. But the fact that someone doesn't have kids shouldn't mean that they're doing double the work either. So we're very conscious of walking that line. I've got an amazing team that is very dedicated and everyone's kind of happy to do whatever it is they need to do to get the mission done. You know, we've had to be very choosy about which things we choose to do. And one of the big lessons we tried to teach people is there are, you know, most of what we do is considered at least by someone important, right? Otherwise we wouldn't be doing it. But there are important things and there are urgent things and they're not the same thing. And there may be many things that are important to do, but if it takes another month for us to do it, that's going to be okay. And then there are those other things which need to get done now. And if that means we need to call extra people into the office that normally would not be in, or use additional remote work sites where we can get access to our materials and that sort of thing, then we have to get it done for the mission.
Thank you. Courtney, is there something that you wanted to say on that?
Sure, definitely. On the point of whether or not we're hearing from our workforce that they're struggling and that they're, you know, truly trying to find out what their option is, it's definitely coming out in different ways, actually. One of the things we first did, actually, we looked at in quarter 2, did we have any attrition? Did we have any, and one of the focus you talked about was working moms, did we have any people leave the workforce because of COVID, and are we seeing any different trends? And I think what we saw was no one had left the workforce just yet. I think there was the fear, the uncertainty that drove that, but we understand though moving forward as we go into the school year, that stress is really going to start to come out and there's going to have to be some different decisions made. So how will we address that? There was, in the same study that I talked about from Mercer, 92% of those that are identifying themselves as caregivers are more stressed right now than they have been. And this has been going on prolonged for 5 months now, and now you have to make some very important decisions for your family. The other thing that we realized that was showing a sign of that was people, especially in the US, and again, being a global company, there are some countries that have more robust vacation policies. But in the US specifically, we don't have as much vacation time, I think, where you're allowed to then just kind of figure out what you want to do. And people have been, you know, really holding that just in case something were to happen. And so we're seeing people are not taking vacation. So therefore, you know, that's a sign that there is some struggle that may be happening. But one of the other ways that we found it was looking at talking with our employee resource groups. And so I want to throw that out as something for people to turn to, and is really thinking about those groups within your company that are meant to raise to leadership concerns that are coming up in your specific population. And I do know a lot of companies out there have working parents, working mothers, ERGs, and I would really strongly encourage that that you look at that you consider seeing if there is some support from there. The other place we're seeing it is through our HR business partners, and I think those are called generalists. They're kind of your point of contact as an employee to go to if you have any questions regarding HR. And we are seeing parents go to their HR business partner to explain that they're struggling. What we've done at Colgate with that is that we've made that a very flexible discussion. So if it's raised, then the manager will get involved and there will be a specific kind of setup and support given to that parent. So we haven't gone directly and said this is kind of our blanket decision to support all parents. We've really encouraged those that speak up to provide some support. And so that is the other avenue. I'd really recommend if you're a parent, you actually reach out to your HR business partner. They are actually looking for you to share what your stories are, what they can do, and that will actually help us form what the policies could be that would benefit most of our parent population. So those are the kind of little ways we've seen this topic come up from our employees.
That was helpful. I think some parents might be scared to raise it, right? Because needing help in our society, for better or for worse, sometimes is seen as a weakness. And then when a promotion comes around, maybe the person who doesn't have caregiving right now gets that promotion. So I think there's some timidness there. Do you also work with managers, especially managers maybe who don't have kids, on how they can support their potential employees who may be suffering in silence? And are there any advocacy efforts being made to sort of look downward and proactively ask those questions? That's sort of a jump ball to everybody as well.
I'll take that a little bit just to start, but the way we're starting that conversation, and I think you mentioned it, we need to destigmatize it's okay to not be okay right now, right? And I think that conversation really needs to start with the manager and their team. And so one of the efforts that we're doing is really looking at how can we give our managers the tools to be able to have that conversation in a constructive and very supportive way with employees, especially if you don't have a parent or you're not a parent, you can't, 100% sympathize or relate immediately. So we are doing that. And the way we're Skyping that is talking about it. We're focused on vacation right now. I think opening it up and starting a conversation about your personal life when it comes to taking time away from work, it allows for that conversation to then open up. And so that's the direction that we've started with. And again, looking for our HR business partners, which are a very safe way for people to raise concerns without their manager. But that's kind of where we're starting right now with that one-on-one conversation. Got it. Anyone else?
One thing that I'm not sure, depending on who the audience members are on the call, that many workers may not be aware of, although HR folks would be the provisions under the Families First Coronavirus Response Act. It's a narrower circumstance, but when you're talking about a family member who's having to quarantine because of suspected COVID, that's time that this person would qualify for for enhanced family leave at 2/3 of their normal earnings, and the employers are reimbursed by the federal government. And if a person's quarantined themselves on medical advice, either for confirmed or suspected COVID, that's not sick leave time that you are taking off out of a vacation or unpaid time. I mean, the law has created for many, not all employers, but many employers, basically this system of tax credits to reimburse them for paid time for their workers. So this is something just to make sure people are aware of. A lot of times no one even thinks to ask. They just assume, well, I know my stock of days and I'm going to have to use those, and that's all there is. But there are some policy features that have been adopted during the epidemic that can be helpful.
Yeah,
Ben, if I could give you... Go ahead, Zach. Sorry.
I was just saying, similar to the others, we've just been trying to maximize the flexibility of the people that do work for us, and that, if someone raises concerns or special needs or whatever it is, we do whatever we can to accommodate it. People are just aware that for us, there's a more limited tool basket of things we can do when people do have to go into the office to do most of the work.
All right, Zach, question for you, not as a government employee, but you personally, Zack Bernstein. If I could give you all the power in the world, unfortunately not to make COVID go away, but to allow you to dictate some sort of policy, whether it's government policy or corporate policy around this topic, what are the things right now that you would zero in on and change?
So a lot of it we've already touched on. The first is recognizing which work is essential to get done now, and which work isn't. I think one of the problems that a lot of working parents have had is employers think they're being flexible by essentially saying, don't worry, you can work a flexible schedule. That's all fine, except you still have a full-time job of being a parent too now. So you're still working 2 jobs. It's just you're doing one in the middle of the night instead of during waking hours. And I think that's a problem. I think what we've tried to recognize, and what I think a lot of people are realizing, is you need to cut back on the work obligations while still getting done what has to get done. Because there's just no way to cram in the same amount of hours into both sets of responsibilities. So I think that's the biggest thing. Offering flexible work schedules on the margins of that to then make it work, right? You know, giving people flexibility to say, I'm going to get my job done when I get it done, but I will get it done. And that's what we've tried to frame it to people is do what you need to do to get the critical mission done and then go home. You know, if there's a day where you finish early and you can go and get more flexible childcare by go do it. Because there are going to be other days where you're going to need to call your husband and say, I know you've been doing this all day, but I need to stay another few hours. I'm really sorry. And you need those chips, for lack of a better way of putting it, with your spouse or with your caregiver or whoever you're hopefully sharing some of this burden with.
Courtney, same question to you. You have the power to change policy, but not to make COVID go away. What do you change?
Oh boy. I would say the biggest thing that I would, and actually I think Zack, you said it very well. I think it's having the ability for us to have certainty in areas where we can. And I think that is the theme of really understanding what's important, what really needs to get done right now. But I also think it goes to, you know, kind of when we're going to feel like the standards are that we're going to go back to something of certainty. And so how can an employer create that? And I think that's what we're grappling with, and why I went back to how can we allow for that flexibility, where we're saying, hey, this is what we can 100% control, and this is what we're going to provide to you. So I think you talked about, Rachel, the whole thought around performance and the worry that is that going to impact you know, my performance or bonus or pay or job. And I think one of the things that I would say is if we were able to all come together and say, you know what, that's not going to happen, and that everyone kind of says that collectively. I do know, you know, we're looking at ways to make that very clear, talking about what, and I would ask, you know, what is my performance going to be based on this year? And I think having certainty in that, knowing it's an uncertain time, I think that's a conversation that I would really love to wave a magic wand and we could all figure out what that means, but it's much harder when it comes to being in a business world and you know, needing to meet those goals. So tough question, but try to create certainty where you can.
Thank you. And Ben, obviously, as a policy guy, I'm totally going to ask you the same question.
Yeah, I mean, you know, to some extent, I'm going to use a public health argument to get around your question. I hope you don't feel like it's asking the genie for 3 more wishes. But what I'd say is that we ought to be doing a much more aggressive job in a national way of reducing rates of community spread. And so, you know, if we did that, if we slowed down or reversed reopening in many of the places where rates are quite high, we would, in the short run, incur some economic pain. Not necessarily clear that it'd be huge amounts, because right now people aren't loving the opportunity to be out of their homes and consuming as they usually do when there's an epidemic raging. But if we were to slow down in the way that some of the states that have gotten things under more control, what you might be able to do within a shorter time frame is realistically and more safely reopen schools, which has an enormous benefit to children, and we cannot underestimate how important that is. And it also would free up the workforce to kind of resume a lot closer to what they normally do. So, you know, I think for employers and businesses in looking at the situation, it's you know, a push to reopen prematurely is harmful to the bottom line of many industries, and certainly kind of the general functioning of our society. That if we can get this under control, then you're able to resume more of these activities with safeguards in place that would let our workers be more productive workers, would let their kids have the childhoods that we all think children are entitled to, would actually be raising the next generation of society to succeed. So, so that would be my goal, is really to focus. You can't snap and make COVID go away. And even when we have a vaccine, unfortunately, that's unlikely to be a highly effective vaccine. There's a good chance this is going to be moderately effective, and it's going to have imperfect acceptance rates in the public. So we are likely dealing with some degree of COVID for a long time. But doing what we can to get safer level, numbers down so we can more safely resume in a matter of weeks or months, but not tomorrow, more of these activities, that would be my priority.
Thanks.
And Rachel, can I add one additional, if I were king of the universe and could kind of do whatever I wanted, it would be for permission for parents to cut themselves a little more slack right now. I think a lot of us, under the best of circumstances, struggle with the balance between feeling like you're doing a good job at work and at home. These are two hard things, and I feel like I'm always shortchanging one of them, and that's under the best of times. Right now, I feel like I'm failing at everything 90% of the time, right? You're cutting it short at work and you're not doing as good a job there. And then at home, boy, my kid has never had so much time with his tablet as he has over the last 5 months. I used to be one of those parents that I was going to reduce screen time. And now I'm shoving that thing in all the time because we don't have a lot of options. And I guess permission for parents to be happy with the gentleman C right now, right? Like if your kid is reasonably happy and reasonably healthy and has eaten a vegetable in the last 5 months, even once, you're great, and cut yourself a little slack because this is really hard.
Thank you. I think everybody collectively needs to hear that and feel that. I think it's harder though when you're comparing yourselves, to other folks who aren't necessarily in that situation as well. And so you had mentioned earlier this notion of your expectation isn't for those that aren't primary caregivers to sort of carry the burden for those that are. But I guess the open-ended question and response is we're all global citizens, right, of this world. So what should...
Did we lose Rachel?
I think we lost Rachel. Her video had frozen, and she.
My video.
Oh, there we go. Got you.
You can hear me. I'm coming back. Sorry about that.
Okay, there we go. Okay, cool. Right on.
Perspective of Wi-Fi. No. So what I was asking was, knowing that Zach, you had mentioned previously that your expectation for those that aren't primary caregivers isn't that they pick up the load for those that are. But as just global citizens, question to you is, what should we be doing to help this overall for everyone?
You mean in terms of the balance between working parents and other employees to make sure that they're not taking on an unfair amount of stuff? So,
yes, with respect to the workforce, right? Because I think we all, if we were asked the question, knowing that this is going to hurt, workers on the front line more, this is going to hurt people of color more who don't have as many potential resources as those who have higher income brackets. Knowing that as global citizens, we have the privilege of white collar jobs and potentially some of our coworkers and peers don't. What can we do to sort of lift everybody up as we climb?
I mean, so from my perspective, I think there's a certain amount of internalizing the idea of burden sharing that we're all going to have to do. As someone that chose to have a child, I'm gonna have a harder time with the COVID breakdown of responsibilities than someone that doesn't have kids. That was the responsibility I took on by having a kid, right? There is this extra thing, and there will be some amount of extra juggling of stuff that employees that have more flexibility are going to have to take on because they don't have something they have to leave at 2 p.m. for, like a daycare pickup. And we're going to have to find that balance between the two, and it's going to for everybody. I'm reminded of when my husband and I first had a kid, and we felt like it was, it's always new responsibilities, and you always feel like you're doing more than your fair share and everything. The best advice I got from one of my good friends was, when you're new to this, you shouldn't feel like you're doing half. You feel like you should feel like you're doing 70%. And if you both feel like you're doing 70%, that's probably about an equal breakdown because it's all new stuff, and so you're always going to feel like you're doing more. And I think that's where we're at now. Is everyone's going to have to be doing 70%. We just got to find a balance there.
And Courtney, knowing that your workforce is comprised of folks who are out on delivery, folks who work in big offices, are you creating policies that are equal for everybody, or are you catering stuff situationally to those who are most in need? And how does that work inside of a global company?
Yeah, it's a great question. I think there is definitely different approaches with those that are going out into the community in general, right? So I think when we look at safety, it's different when we look at a plant and how we're keeping people safe going to and from work. So there are different, policies and procedures we have in place there. Does everyone have access to them? Yes, but will they probably need them? Probably not. So I think the way we look at it is if you're going to go out into the community for your job, these are kind of a set of things that will provide everyone in that bucket, versus you're working remotely and that's where you can perform most of your job functions. So we're looking at it in that way, just to make sure we can align, and there's been mention around, kind of safety obviously being number one, that there are certain things we have to do for certain populations. I think the piece that I thought was interesting when we were talking about sharing the burden, Rachel, if I can talk about what we're looking to do, and you talk about thinking about that, is regarding being respectful of somebody's time. So for example, if I block off my calendar, and so this is something we're trying to do universally, kind of taking our Meet Smart policies that we put in place within our company and align it to the fact that if somebody has blocked off or says they're away, that you respect that, right? And it goes vice versa. So it's something that it wouldn't be just if you have a child or not, but really it's at the benefit of us thinking about ways we can make sure that a parent can do that and not feel like it's because I have a child that I'm trying to block off that time or saying I'm stepping away. We're shortening meetings, requiring no meeting days, so that we can allow for parents to, and everyone to kind of find flexibility or plan things for their family in certain times during that week. And so those are the things we're trying to do to create some equality in that space. But definitely safety first, I would say, for those going out into the community is the biggest concern that we're seeing that's different than those that potentially working remotely.
That was really helpful. And you hit on something that, the one personal anecdote that I wanted to share is I've never felt more caught when I have a last minute deadline, because those are those moments you can't control, right? For the most part, if you're getting some reprieve with some version of childcare and you're having to educate your kid and you're scheduling yourself out in a way where you're trying to maximize your time most efficiently, the minute something in your life breaks, whether that's a new last minute work deadline or something in your house breaks physically, I feel like that's when the house of cards keeps falling down for parents. And those are the moments where it's just so unbelievably hard to recover. Brian and I had a moment where I had to say, is this urgent? I'm not sure I can do this right now. I could probably get it done by X time. And we have a good relationship. I'm thankful to have work from him. And I felt brave enough to sort of offer that up. But not everybody's in that situation. So Courtney, I looked at you again, just given the role that you're playing with HR and wellness. For managers who maybe aren't parents, this is unprecedented for everybody. For managers, there's no playbook to help managers help employees in these moments. Are you guys rewriting the script? What kind of conversations are you having to sort of help? I talk about like universal or global citizens or collective good, but is there a way that folks that maybe aren't feeling this burden as hard are helping within the workforce and discreetly within their specific roles?
The way, it's such a good point. I think the way we're doing that is leadership needs to model that behavior first. And so when you're talking about that last minute deadline, sometimes, it's something where back, it was okay. I'm just thinking about it now. Let me put it on your plate. And now you have to figure out how to do it. So what we're actually doing is we came up with what we consider to be kind of guiding principles that we're socializing with our leadership team, and hopefully they'll start to disseminate that and hold their teams responsible. I think the best thing, Rachel, in this is that we're looking at it at the team level, because that's really where this is going to be. And so empowering and making sure that norm changes and allowing for people to say, instead of handing a deadline, we're actually saying, hey, looking to do this. When can you get this to me? And so we're working talking points into those conversations differently now than we have in the past. And so that's definitely happening, and really making sure we reframe conversations. We're ending meetings in a way where we're saying you stop, and our meeting now ends at the 50-minute mark, so everyone can talk about what they're going to take away and do, instead of those meetings continuing to run over and everyone's like, well, what do we do now? So we're really trying to make that the norm, so we can avoid people feeling, what do I do now in those last minute situations.
Got it.
So.
Got it. Thank you for that. And we saw Ben blink out for a second, and that was just a dose of real childcare reality. You had to go deal with a child. I think the one thing, you know, if I could give one piece of advice, and I want everybody to have it, is if your kids run on screen, like everybody else, just applaud them, take a bow. Like those guys are the heroes who are multitasking quite literally, like the kids' Zoom session with the work conference call. And those that aren't, just give everybody a little bit of a collective break, right? Like I think everybody just needs the hug you can't get right now and just a collective break. And I think if everybody could just be a little bit kinder and a little bit more forgiving in these times and take a breath and lower expectations of this alpha workforce type, we'll be a little bit better off. But that's my sort of like, if I could give one bit of advice, I'm just curious what you guys have, and let's take a moment to get some questions from folks who are listening.
Yeah, I mean, for me,
any advice, Zach or Courtney or Ben? Yeah.
You know, I second that. It's what I was saying before of cut yourself some slack. You know, you are doing 2 jobs and they are both full-time. And if you're a parent like me, you never had any particular inclination or interest in being a stay-at-home parent. No, not a dig on anyone that does want to do that, but I did not, very much not, and neither did my husband. And now we both are, while also being full-time working parents. So it's, you know, it's hard, and cut yourself some slack.
We have a question from Sarah Nicole for Ben, and for anyone else who is on here, feel free to throw questions into the chat, or there's a Q&A button, and we'll direct them to the panelists. But for Ben, Sarah Nicole asks, you touched on the impact on children. Do you have big picture recommendations for things that we can do to improve this experience for kids? Presumably meaning while they are, well, maybe both, while they're at home and when they do go back to school and face, a different school than they're used to.
Yeah. So I guess the caveats here that I'm a primary care doctor for adults, not kids, and I am a parent, but by no means an expert parent. So, I think there are some things that we know from kind of just the broad literature on child development that are relevant. Outdoor time is really important for kids. And that's now one of the few outlets that they have, right? So finding ways to be outdoors with your children and to let them be outdoors when the situation allows it is great. Whether that's kind of structured family activities like hikes or just, tooling around and, outside. Outdoors is a pretty low risk environment. So, I think some parents may say, well, we can't go to the neighborhood park because they're gonna be other kids around. Kids with masks in an outdoor space that they're not doing, the CDC defines a high risk contact as more than 15 minutes at 6 feet or less. So, your kid running by another kid on the playground and that other kid doesn't have a mask on and it's like a 2-second encounter, that's not a high risk encounter. Like that's not a reason to keep your child from being able to run around and be outside. Now, should your kid be sitting on the jungle gym for 10 minutes right next to another kid who doesn't have a mask on? That's not great. I wouldn't recommend that. But I think we have to have some balance of being cautious, but not so protective that our kids aren't getting any sort of both physical exercise and also just opportunities to enjoy themselves and be around other kids. But again, each of these sorts of decisions have to be made on a case-by-case basis, and there's no golden like simple answer as to like what you should allow your kids to do. I think the other thing that's important, to the extent that your kids are old enough, is to share your own frustrations and concerns and be honest about it, right? I mean, like this isn't normal, right? The world that we're all dealing with isn't normal, and acknowledging that it's hard for them and validating that feeling is, I think, really important. So, again, I'm no secret formula that I have, and but those are a couple thoughts.
Awesome, thank you.
Thank you.
Other questions from the crowd? I guess one for me is like, for all of our panelists, like, how are you feeling? Like, what's, I think we've heard a little bit about it, but on a personal level, like, how does back to school look for you?
So for me, I mean, this whole process has been hands down the hardest prolonged period of time that I've ever experienced. And it comes with sort of emotional waves and ups and downs as it gets harder. And sometimes you feel like, oh, I'm starting to get the hang of this. And then, you know, kid will throw a tantrum and you're like, I don't have the hang of this. What am I doing? You know, for us, one of the sort of big decision points we made a little while ago was, you know, we needed to be able to have our kid have a little bit more contact with other humans. For his mental health, and as a result, we basically had a hard talk with my parents, who were my father is high risk, and we agreed we were not going to be having contact with them for a while in person, because we needed to be using that bandwidth to be able to give him something that felt a little bit more like a normal childhood. And everyone agreed to that, and it's one of those hard choices that we made in order to be able to do some of the things that we felt he really needed in terms of socialization. And it's tough. It really sucks, but that's, you know, for us, it was the right choice. And I think it's been good seeing our son have an easier time now that he's getting a little more interaction.
Yeah, I think my answer to that is, this has been hard, and even when I ask for help, I think the solace is, I know that I have it easier than a lot of other people, right? We're a two-parent household. We have some resources available in terms of childcare, and we made the decision to pod in with our childcare, and that's literally our neighbors. And we got so lucky in that they have college-age kids who are home. But I'm on vacation this week, and if I'm honest, I spent the last 3 days writing a preschool contract to try to create a preschool pod in my basement. Obviously, I've never run a preschool before. I don't know how to mix students and make them appropriate and hire a teacher. And then every parent signs a social contract about our risk levels. And I'm also not going to be able to see my family because I'm contracting in with these folks. And that was a decision that I made both for my career and for my kids. And it felt hard. And yet I know that was a relatively easy move for our family to make. So I think I just marvel at really what feels like the impossibility of this situation, and just try to figure out how I can be the best possible parent and manager and spouse in this environment and in this time. And it's challenging, to say the least, on the best day.
Yeah, I mean, I would echo what Zach said, that you know, that this has been the hardest thing I've done in my life. You know, I used to think that being in you know, first year of residency, kind of the 80-hour weeks and the 36-hour shifts and that sort of thing. I guess they shortened to 30 hours. They were more humane. That was going to be the hardest thing I ever did. And having you know, basically like, you know, 100+ days straight where we literally didn't see anybody other than the four of us, and then our patient care work was, you know, it's just it takes a toll, and you feel like you're treading water, but you just have no idea how long you have to tread, and it's incredibly difficult. You kind of really do take it day by day, because if you stop and look at the horizon, it's sometimes a pretty overwhelming feeling. So now life has gotten slightly more back to normal in Massachusetts, by no means normal, but you know, with lower rates, there's summer camp programs that are open. So our kids have gotten to do a couple of weeks of camp, which has been fantastic for them, has been you know, really great for us. But you know, that's coming to an end, and the school picture is quite unclear. And again, like I said, things can be good for a couple of weeks or months with this epidemic, and then come right back. And so in November, we may very well be looking like we did in March and on full lockdown. We just don't know. So it's, you know, it's hard to prepare for that. And I think to some extent you do the preparations you can, but otherwise just, you know, you try not to dwell on what you don't control. And you know, like Rachel said, make preparations that fit your scenario the best, and try to be easy on yourself.
Courtney, how about you in our last minute before we thank you all for what I think has been really, really interesting discussion.
So I, you know, just listening, and I think it's the empathy piece that coming in and hearing these stories. I've been supporting my nieces, but it was one of those moments of them making the decision. You talked about, Zach, of the social interaction and making that call of going to see, you know, them and being part of their life. And it's one of those pieces that I think the lack of social interaction has been probably the hardest, and being there in the ways you used to be there. And I think if I were to say one piece of advice, and this is coming from just kind of the world of well-being, is self-care. And I think the big thing that we can, all do, no matter if we have children or not, is to really think about that. And what are you doing for yourself? And really think about what are those pieces, because really for you to show up, whether it be at work, as a parent, in your life, with your significant other or family, that's something to keep in the back of our minds. And if we all do that, then I think collectively it will help us all, support each other through this time. But that's definitely,
Thank you.
It's been, yeah.
Well, thanks everybody. This has been really good. Yeah, Rachel, thank you for moderating too. We're right at the top of the hour. Go ahead.
No problem. No, I was just going to say, I recognize the irony of this panel, which is that, I think a lot of the people who probably wanted to hear this panel are probably prioritizing a lot of their day-to-day work. So even with this, I'm like, cool, let's write up some of the tangible bullets and just send that out so we can disseminate it and distill it down into a 3-minute read, because that's probably what a lot of parents need too, right? And I think it's those things for managers to start thinking about. And that was sort of my parting words, is just every manager, think about how to distill your employees' jobs down to the bare essentials that you need, and don't penalize them for just doing that. Like that, I think, is the collective belt loosening that we can all do for one another.
Yeah, great. And we will be making a recording available if anyone wants to share this with folks that weren't able to attend. So thanks again, everybody. That was really great. I really enjoyed hearing from you all, and I really appreciate the time that everybody spent with us today. And Rachel, coming in from vacation to conduct this panel is a real power move. So thank you all, and hope to see you guys on the next one of these. See ya.
Thanks.